So more on the Senate Republicans' latest plan to repeal Obamacare. We are live on Capitol Hill, where there's growing momentum for a bill that some in the GOP view as a last resort, the skinny repeal.
My guess is we're going to have to figure out some kind of skinny down version. It's disappointing to me, but we're going to have to keep this process moving. Otherwise, we're stuck with the mess that is Obamacare.
But Chuck Schumer, the Senate Minority Leader, is concerned about the impact of a skinny repeal and what that could have on the American public.
If the reports are true, the Republicans will offer a skinny repeal plan. We just heard from the nonpartisan Congressional Budget Office that under such a plan, as reported in the press, 16 million Americans would lose their health insurance, and millions more would pay a 20% increase in their premiums, at least 20%.
Joining us now is John Goodman, president of the Goodman Institute for Public Policy Research and senior fellow with the Independent Institute. Sir, thank you for joining us. Isn't it a little disingenuous of Chuck Schumer to get upset about the skinny repeal? I mean, isn't it just a vehicle for continuing the negotiations? It's not what the end product is going to be. Is that right?
Well, you're right, but we still have to look at it. And no one likes the mandate, so there's an employer mandate that will be gone, there's an individual mandate that will be gone. But if that's all you do, then that gives people an incentive to remain uninsured until they get sick. So what Schumer missed the boat on is when he said these people will lose their insurance. No, they will choose not to insure until they get sick, but that's not a good result for the system.
No. In fact, if you can stick with us on the other side of the break, we'll talk about the changes that would need to be made after that in order to keep the system viable. Stick with us. Thank you. Okay, I want to welcome back John Goodman, president of the Goodman Institute for Public Policy Research and senior fellow with the Independent Institute. Thanks for sticking around with us. What do you think needs to happen to this system in order to make it more viable? What would work?
Well, what we need to do is we need to extend that tax credit that's now in the individual market to people at work. People who work for McDonald's and Burger King. Those folks aren't getting any help from Obamacare. But 85% of the uninsured have a connection to the workplace, and group insurance is cheaper and better. So instead of doing what Obamacare does, pouring all the money into the individual market, throwing good money after bad, Republicans should make that tax credit available for everybody.
What about the idea of grouping people together in associations? I mean, I understand what you're saying, that having people out there buying individual insurance is very difficult to tackle. One of the other ways, rather than through the workplace, that folks have suggested is, why don't you have everybody who works as a plumber get together and everybody who works maybe in the service industry, that they can be groups and even across state lines?
Well, you could do that, but remember, people are already grouped through their jobs. So I say let's start with the associations we already have. If people want to form new ones, that's good. But insurance at work is cheaper and better than insurance in the individual market. So let's at least start where we are.
We're still talking about subsidizing, though, with taxpayer dollars, the price of health care policies. And that doesn't say anything about the cost of actually receiving the care. And it is all more tax dollars. So I don't know that that solves the problem. How do you deal with the affordability problem when it comes to actual services?
We've got to quit insisting that people buy these policies with all these bells and whistles and that have deductibles that are $6,000 for an individual and $12,000 for a couple. Instead, they need to buy insurance which is suitable for their own needs and their own financial situation. That means fairly low deductibles and health savings accounts. And then we've got to keep these plans from dumping their sick people on each other in a race to the bottom where they're all trying not to have cancer patients or heart patients or diabetics. So the market needs to work like a real market, and we need to empower and liberate individuals.
Easier said than done. We'll see. We got a lot of work to do. Thanks for joining us. Appreciate your time.
Glad to be with you.